Did you know that some medications we use daily can silently increase the risk of developing dementia? Yes, it's true. What might seem like a simple prescription to help your health could have serious consequences for your brain over time. Today, we're diving into the world of prescription meds to uncover the top 7 drugs that, according to various scientific studies, have been linked to an increased risk of dementia. Don't go anywhere, because the last one on the list might surprise you, and it could be closer than you think. Stick around until the end of the video to find out how this information can change your routine and help protect your brain from long-term damage. 1. Anticholinergics. These medications are found in common products for allergies, colds, and even to help you sleep, like Benadryl. What many people don't realize is that anticholinergics block the action of acetylcholine, a key neurotransmitter for memory and learning. A study from the University of Washington showed that prolonged use of anticholinergics is directly linked to brain atrophy and an increased risk of dementia. So, if you frequently take allergy medications, especially if you're older, it's a good idea to talk to your doctor about safer alternatives. 2. Benzodiazepines. Benzodiazepines are widely prescribed to treat anxiety and insomnia, with medications like Valium and Xanax being well known. However, studies from the University of Bordeaux indicate that long-term use of these drugs can significantly increase the risk of dementia. Elderly patients who use benzodiazepines continuously have up to a 51% higher chance of developing severe cognitive diseases like Alzheimer's. This happens because these medications depress the central nervous system and interfere with cognitive functions over time, leading to memory issues and confusion, especially in older adults. 3. Proton pump inhibitors. Medications like omeprazole, commonly used to treat acid reflux and gastric ulcers, are another class of drugs that can affect mental health. Research published in JAMA Neurology showed that prolonged use of proton pump inhibitors can reduce the absorption of vitamin B12, which is essential for brain health. A deficiency in this vitamin is directly linked to cognitive decline and an increased risk of dementia. Often, the use of omeprazole becomes chronic in older adults, which can make this issue even worse. 4. Tricyclic antidepressants. These antidepressants, while effective in treating depression, also have anticholinergic effects, which can impair memory and other cognitive functions. A study published in the British Medical Journal found that long-term use of tricyclic antidepressants in older adults is associated with a 30% higher risk of dementia. They directly affect brain neurotransmitters, impairing mental performance. Additionally, these medications are often prescribed for sleep disorders and chronic pain, making them even more common among the elderly population. 5. Antipsychotics. Antipsychotics are primarily prescribed for severe mental disorders like schizophrenia and bipolar disorder. However, a study from Harvard Medical School showed that long-term use of these medications, especially in older adults, can accelerate cognitive decline and increase the risk of dementia. This happens because these drugs deeply affect brain chemistry, leading to progressive memory loss and cognitive dysfunction. Additionally, many antipsychotics are used to control agitation in dementia patients, which can create a vicious cycle where the medication for behavior worsens mental decline. 6. Medications for incontinence. Urinary incontinence is a common issue in old age, and medications like oxybutynin are often prescribed to manage the condition. However, studies show that many of these medications have strong anticholinergic effects, which can negatively impact memory and brain function. A study published in JAMA Internal Medicine showed that long-term use of these drugs can increase the risk of dementia by up to 33%. If you use bladder control medications, it might be worth discussing alternative options with your doctor. 7. Blood pressure medications. Beta blockers, used to control blood pressure and heart issues, have also been associated with side effects that can impair cognition. While essential for many patients, research suggests that long-term use may be linked to an increased risk of mental decline, particularly among the elderly. Uncontrolled blood pressure is already a risk factor for dementia, but the chronic use of medications to control it, such as metoprolol, can make the situation even worse. If you enjoyed this video, don't forget to check out these other videos to improve your health and learn more about how to protect your memory and your brain. See you next time.